Join me for Part 2 of Medicare Babe Series 2, titled Medigap and Part D Costs. Medicare Supplement Insurance, also called Medigap. Medicare Supplement Plans helps pay some of the out-of-pocket costs not paid by Medicare Parts A and B. Medicare Supplement Plans works with original Medicare Parts A and B and Medicare Part D. Can't be used to pay for Medicare Advantage costs. 10 plans standardized by federal and state law. Plans are labeled by letters, example Plan A, Plan G, and what costs and services are covered vary by plan. Plans with the same letter offer the same basic benefits nationwide. Massachusetts, Minnesota, and Wisconsin standardize plans differently. Plans are offered by private insurance companies in your state. Note: Plans C and F are only available to individuals who were eligible for Part A or turned 65 before the 1st of January 2020. Here are some of the costs that Medicare supplement plans may help with and some that they may not. Part A Hospital Coinsurance. Part A Skilled Nursing Facility Care Coinsurance. Part B Coinsurance or copays. Cost of blood transfusions. First 3 pints. Costs for 365 days in the hospital past the lifetime reserve days. Hospice Care Coinsurance. Part B Deductible. Part A Deductible. Foreign travel emergency care up to plan limits. Provider charges above Medicare's approved amount. Medigap plans do not help cover prescription drugs, routine dental, vision or hearing care, eyeglasses, contacts or hearing aids, custodial care, help bathing, eating, dressing, long-term care. Note: Medigap insurers may make value-added services available either free or on a discounted basis. This Medicare supplemental table may help you visualize which costs different standardized plans help with and the level of coverage. 100% means 100% covered. The main point here is that Medigap plans vary and have letters as plan name. Now let's move on to Part D, prescription drug coverage. An easy way to think about this is D for drugs. Remember, drugs are not covered by original Medicare except in select circumstances. You can get drug coverage in 2 ways: through a separate standalone Part D plan, or through a Medicare Advantage plan, as we just discussed. Standalone Part D plans can work with original Medicare, Medicare Supplement insurance plans and select Medicare Advantage plans including private fee-for-service plans, PFFS, and medical savings account plans, MSA, without drug coverage. And like Medicare Advantage plans, Part D plans are offered by private insurance companies. Each Part D plan or Medicare Advantage plan that includes drug coverage creates a list of specific drugs that it will cover. The list is called a formulary. Each plan has its own. Many Part D plans group the drugs they cover into levels, or tiers. Drugs in different tiers have different costs. For example, you may pay more, a higher copay or coinsurance, for a Tier 5 drug than for a Tier 2 drug. Also, plans may have a deductible for some tiers and not for others. When choosing a plan, it's important to make sure that the drugs you take are on the plan's list of covered drugs and to understand the costs, which can vary from plan to. Let's take a minute here to talk about the different Part D cost stages. Especially in 2025, there is no Part D coverage gap, commonly called the donut hole. There are 3 Part D coverage stages. The stage you're in determines the amount you pay when you fill a prescription. Each stage has a dollar limit, set by Medicare, that marks when you exit that stage and enter the next. The limits, shown here, can change from year to year. You begin in the deductible stage, if your plan has one, where you would pay the full cost for your drugs, or in the initial coverage stage, where you usually pay a copay. If your drug costs reach the limit for the initial coverage stage, then you would enter the catastrophic coverage where you pay 0 in 2025. The cycle starts over on January 1st. A few final points about Part D. You are eligible to join a Part D plan once you are enrolled in Part A, Part B or both. Plans often have pharmacy networks that you need to use to get the plan's pricing. Plans may vary quite a bit in terms of what specific drugs they cover and what your costs may be. A final key point is that you could be charged a premium penalty if you are late enrolling in Part D unless you qualify for a special enrollment period. Thank you for watching our Medicare Babe series. We invite you to watch the next video in our series, entitled Medicare Enrollment. You are invited to subscribe to Camaraderie Health Agency LLC YouTube channel.